When a bleeding emergency happens, every second counts. Your Stop the Bleed kit from Rescue Essentials is designed to help you take immediate action. Let's walk through the essential components inside your kit. Each kit is carefully assembled with the tools you need to control severe bleeding effectively. The intermediate Stop the Bleed kit includes nitrile gloves, a pair of shears, a tourniquet, wound packing gauze, trauma dressing, chest seals, a survival blanket, and a permanent marker. Trauma shears allow you to quickly cut through clothing, giving you direct access to the wound site. A high-quality tourniquet is one of the most critical tools for stopping life-threatening bleeding from an arm or leg. You'll want to unwrap your tourniquet from its plastic packaging immediately after getting your Stop the Bleed kit. Our bleeding control kits come with your choice of a SAM XT, SOF, or CAT tourniquet. And while the basic application is the same, there are some key differences. Place the tourniquet around the injured limb, at least 2 to 3 inches above the wound. Pull the strap tightly. Then twist the windlass rod until the bleeding stops. Then secure the rod and note the time of application with the marker provided. SAM tourniquets will audibly click when they are pulled tight enough around a limb, letting you know when to start turning the windlass rod. When using a CAT tourniquet, the Velcro on the band will keep it secure around a limb before you tighten the windlass rod and secure it inside a clip. When using the SOF tourniquet, be sure to use the triangle clip to secure the windlass rod before writing the application time. Each tourniquet will come with its own written instructions. Be sure to familiarize yourself with your tourniquet before storing your kit. Use compressed gauze to pack deep wounds and apply direct pressure to control bleeding. It's also ideal for treating wounds in the groin and shoulders that are not able to be addressed with a tourniquet. Use the trauma dressing for additional compression over a gauze-packed wound. Tightly wrap the dressing directly over a wound and secure with the attached clips. To apply a chest seal, wipe away any dirt or fluids with the provided gauze. Peel back the transparent backing from the chest seal and center over the wound. Firmly press onto the skin, ensuring a good seal, and smooth out all edges. To use the emergency blanket, lay it out next to the patient, then carefully roll them to one side and pull the blanket about halfway underneath them. Then roll the patient to their other side and continue to pull the blanket under them. Then wrap the blanket around the patient, covering as much surface area as possible, being sure to wrap around the side and top of the head as well. Your Stop the Bleed kit gives you the tools and confidence to act fast in an emergency. Remember, being prepared can make all the difference. Ensure your home, workplace, or school is equipped to respond when seconds count.